Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. How are you?
Hello, Hallie. Doing good.
Good. Well, we kind of started our month of looking into diabetes with our last episode. That was more of a broad overview. I think this episode we should focus more on treatment of diabetes and help our viewers kind of pinpoint what they can do to control their blood sugar levels.
So why don't we start with the big picture on diabetes, so that if somebody didn't see the previous show, they'll have some kind of sense of this thing. Diabetes is a problem where your body's ability to regulate your blood sugars is not adequate. That's probably the nicest way I can say it. Basically, it's broken. And you may wonder, why do we even care? I mean, a little sugar never hurt anybody, right? Except for no.
It wreaks havoc. It wreaks havoc on your internal organs, on your hormones, on everything.
Yeah, let's go through the short list of what sugar does. If your sugar levels are running too high, and let me be more specific about this. If your sugar levels are running high enough that your body's ability to clean up the mess is exceeded. Yeah, because sugar is sticky by nature. And so you get it in your bloodstream, it starts sticking to stuff. So does everything it stick to it get ruined? No. If you got a little piece of sugar stick to your elbow right there, my elbow works just fine with a piece of sugar on it.
Right.
Doesn't get in the way at all. Except for if a little piece of sugar sticks in my eye, not so much. No. Now my eye doesn't work. It's a little fuzzy. It doesn't work quite right. The pressure is not quite right. There's a zillion things that'll go wrong with my eye that, given enough time, will cause my eyes to go blind. The number one cause of blindness in the United States is high blood sugar.
Wow.
So our body has the ability to clean up these blood sugars. We have specialized cells that go in and they scrape and they saw out pieces and they put new ones in and they, set it up, and they have this whole repair crew that comes in mostly at night when we're sleeping and fixes all the damage from having sugar in our system. Our system runs on sugar. So there's going to be some stickiness that's going to take place, and so our body's set to deal with that stickiness. Except if the stickiness is too much, the repair crew can't clean it all, and so you lose a little ground. Now, if you lose a little ground now and again, who cares? It doesn't really do anything. It's not enough ground loss to result in any kind of, like destruction of stuff. But you lose a little ground every night for 20 years, now you're screwed. Now you have bits of you that just don't work right anymore. So what parts of your body are we really concerned about? Well, that's easy enough to go through. All we need to do is figure out what parts of the body get broken from diabetes. So let's go over the list, and we'll go from worst case scenario down. The worst one is your nerves, because when your nerves go bad, it hurts. It mostly burns. Yeah, you get numb, but the numbness does not
But it's
get
not
so much so
just
that you can't.
numbness, it's tingling. It's an incessant tingling.
No, you can get actually some numbness where you can't feel stuff.
Okay.
It's usually in your feet, or your hands, your feet especially. It feels like they're wet.
Okay.
Like they're funny, they're wet, they don't feel right. That's the least of it. The most of it is they feel like they're burning. Like somehow that my feet have been put into the fire.
Yeah.
Right? And now your life is a living hell. I mean, really, what some level of hell is feet burning?
That's probably like the 5th level.
Something like that. Up there.
Yeah.
Yeah, for real. So this is a really, really, really serious problem. And there is not much that can be done about it in normal medicine. Now, we treat it all the time, and I could do a show on this. Maybe we should talk about this specific thing here in a moment.
Diabetic
because that's
neuropathy.
the biggest one of the problem. Yeah. So the other thing that shows up that we already mentioned is blindness. I don't think that's necessarily second on the list. I think blood vessel dysfunction, because that results in heart attack and stroke and poor circulation, and it helps move the neuropathy along.
Right, and the poor circulation affects the neuropathy.
Yeah, they're connected.
Yeah.
It's not like the poor circulation it causes neuropathy. The blood sugars themselves cause that problem, and I'll come back and talk more about how that works and what happens. And we're just making a list right now. So top of the list is neuropathy. Second on the list, I say blood vessel damage, circulatory damage. Next one I'd say be blindness. Next one I'd say be kidney failure. There's other ones that go on the list. Some rate to fit. Yeah, there's other stuff. The amputation thing where you have to get your foot cut off. That's like a side effect of having poor circulation. Anyways, all right, now let's talk about how to treat the diabetes. So we did the setup here in terms of we need to treat it, but now how to treat it. Now before we do that though, I want to talk about some of the mechanisms that are involved with the neuropathy and also in the cleaning thing. Remember we started that one? Let me pick up those loose ends. I want to actually put some numbers on it. There is a capacity we have to clean. It turns out it's measurable on a A1C. There's a blood test that you can do to see how much sugar accumulation is going on. A1C, the test really is they take hemoglobin, which is a molecule that's in our red blood cells, and that one will pick up sugar as well.
Okay.
And so we could take that hemoglobin and then measure how much of the hemoglobin has sugar attached to it. And so if the number is 5.4 or less, your body's keeping up. If it's 5.5 or higher, your body's losing ground. Okay. Now 5.5 is just on the edge of it, so you're not losing much ground. So if you look at people who run at 5.5, the biggest problem they get is dementia, and it's like 30, 40 years down the line. So it's a pretty low chance of getting it, and it's not kidney failure, it's not blindness, it's not this other stuff we're talking about. Now if you're finding somebody who have an A1C, let's say, of 6 or 6.4 or 5, given enough time, they'll get these other problems. If they're running 7, given a shorter period of time, they'll have all the stuff we're talking about. They're running 8.5, the time gets even shorter. They're running to 16. You're not going to make it more than 10 years
An
before your body.
A1C of 16?
It's real. I've seen it. Here in our practice, I have somebody show up with a 16.
Wow.
And that person is cruising for a bruising. Their body is accumulating sugar so fast that they're just going to fall apart. And their system is falling far short of its ability to clean. So I'm going to show you with my hands. This is a 5.4, right? This is how much cleaning you can do. If you're running a 5.6, there's a gap. And that little gap, that's what you lose every day. You lose a little teeny bit. You're running 6.6, that's the gap you're losing every day. A lot more, right? You're losing a lot more ground every day. So that's how you want to think about it. We want to get that A1C down below 5.4. At that point, you can keep up. You get it to 5.2, now you're gaining ground.
What's a healthy A1C? Is it the 5.4?
That's it, 5.4.
Or is there
5.4 and lower.
A1C?
Yeah,
okay.
5.4 or lower. Now it gets low enough, let's say you're into the 4s, 4.8, 4.7, 4.6, somewhere around there. Your blood sugars are running so low that your body can't function, that it's on some level it's hungry.
Yeah.
So you're measuring the fact that the blood sugars are just running too low, and your body's not getting enough sugar to be able to do what it needs to do.
Okay.
So there is a too low on this thing. The name for that is hypoglycemia.
Okay.
So people with hypoglycemic tend to run into low A1Cs. We see those ones here as well. Those people are also sick.
People hypoglycemic at risk for diabetes?
Yeah, it turns out a lot of times when your blood sugars break, they don't break in just one way. They go hypoglycemic, and what will happen with hypoglycemia is not that they run low all the time, it's that they drop. The numbers drop really low, and you get spacey, and you get tunnel vision, and you get all this weird stuff.
Woozy.
Yeah, all that stuff. And then they come back up again. And so if you run an A1C and they come out fine, they're 5.3, except for the blood sugars run high and low, high and low, high and low.
And so it's the
and
high.
That's a precursor to it breaking, and then they start running high all the time. Not always. Not everybody doesn't always progress all the way to the end of the line, but there's stations along this trip.
Right. Okay. So I'm going to put a pin in that because that'll be important when we come back to treatment of it.
Let's go back to the neuropathy.
Yeah.
So the deal with neuropathy is that our nerves, which start in our spine and work their way all the way out to our feet or to our extremities, the long nerves, there's stuff in our spinal cord and in our brain that our nerves need to do their job. Materials, molecules. And so there's a transport mechanism. These molecules are made in our spinal cord, let's say that way. And then they get moved along this little tube. And that tube runs all the way out to your feet. Now that tube can occasionally get blocked, and the sugar gets in the way, and so the transport doesn't happen right, and so it falls apart. So this is a real problem. So let's talk about the treatment of the neuropathy, because that's a common early sign of having problems with your blood sugars, is that you get neuropathy. So the thing to do to treat this, there's some things that you can take that are going to help protect your nerves from the effects of blood sugar. The best one is alpha-lipoic acid. It sounds like acid. I don't want to take acid, but the acid is super mild. It can't burn you, doesn't upset your stomach. Doesn't have any problem like that whatsoever. What you do is you take one of these pills in the morning, and you take one of these pills in the evening, and that added alpha-lipoic acid acts as an antioxidant that helps protect the nerves from the damage that they get from the blood sugar. It's not the cure for diabetes by any means, but it's something that helps a bit, and it helps with the nerves particularly. The other thing that can be done with this is to improve circulation generally. If you can get more blood flow to your extremities, then the blood flow itself tends to heal the nerves and it's a workaround and an alternative transport system, at least for some stuff. And so the neuropathy tends to improve. And the other thing that you can do to improve circulation is a treatment we talked about before where you do the hot and cold foot soaks.
The hydrotherapy.
The hydrotherapy. You get 2 foot soak baths. You put hot water in one and cold water in the other. And you put your feet in the hot water, and then you move them over to the cold water,
and
then back to the hot water, and back to the cold water, back and forth. And what that does is it causes the blood vessels to dilate when they're in the hot water and constrict when in the cold water. Dilate, constrict, dilate, constrict, dilate, constrict. It's like working a rusty gate.
Yep.
And it just kind of opens it up, and then circulation is better. The trick of that, though, is you have to finish with your feet in cold.
Yep.
Goes against common sense. You think, I want to finish on the hot part to feel good. You finish on the cold part. You take it out, and then the blood vessels dilate.
On their own.
On their own.
They
dilate on their own, and they stay dilated.
Through. Yep.
That's why it's a trick, because the dilation is what actually helps. And you're knocking the rust off by doing the open and close thing, and then you open. You finish on open. And circulation's better, and you do better. If you do it once or twice, it's helpful, but it doesn't really cure it. It's the kind of thing where you have to do ongoing. You have to have this be a regular thing that you do. And you can minimize the impact of the blood sugars, high blood sugars, on your feet or hands, as the case may be. So let's talk about how to avoid the diabetes to begin with. Now, the problem with this one is the blood sugars are running too high. So what we want to do is not let the blood sugars run too high. So how do you do that?
I have a little bit of knowledge of diabetes myself, so...
Yeah.
I would think that it would come from a routine pattern of ingesting food that isn't going to spike your blood sugars. No simple carbs, no sugars, lots of protein, lots of fiber, and set it up in a timing. You eat, I come from a bodybuilding background. I ate every 3 hours. That way that kept my metabolism burning through the day, and my body wasn't seeking where that food was coming from. It knew that that food was coming at a certain time. So when I think of treating diabetes, I think of timing it exactly in that way so the body isn't scouring and it's not going into reserves and spiking that blood sugar.
Yeah, so you're exactly right. So the key, let me repeat what you already said, because you said it well, but I just want to emphasize it, which is the solution for diabetes, the treatment of diabetes is routine. That's what it is. Now, at that point, we need to set up the routine. What's going to be our routine? How are we going to set this up? So let me give you some simple rules to follow that will, 3/4 of the time or 5/6 of the time, just basically cure diabetes. The rules go like this. Number 1, eat protein with every meal.
Does it matter in which order, if you eat your protein first or your vegetable first?
Not necessarily. I do them together. Like, let's take an example, a stir fry. It's got some protein in it. It's got some vegetables in it, right?
Yeah.
It's got some rice in it, maybe. And we'll talk about rice here in a bit. So you can eat the vegetables and the meat in any order you want, because what the meat's going to do, or not necessarily meat, protein, because it does not have to be meat.
Sure.
Tofu would work. Beans work. They got some carbs in them, so they don't work quite as well. But there's other sources of protein. Cheese, for example, is another source of protein. Some people do very well on cheese, some people don't. So you just have to know who you are. You have to pick the best proteins for you that there is, and you live on those. Those are the ones that you eat as a regular kind of routine. This is the proteins that you get into your diet. Some people do well with yogurt, for example, which is very digestible protein. Other people go to hell in a handbasket.
But is yogurt risk because it does have naturally occurring sugar?
Yeah, it's something to consider. Okay, so something to consider. It's not like you have to avoid sugar at 100%. What you have to do is you have to avoid spiking your sugar 100%. Now, yogurt is not necessarily going to spike your sugar because it's got a lot of protein in it itself. It also has some naturally occurring sugars in it, but those naturally occurring sugars are really low compared to the amount of protein that it has.
Okay.
Now, we have to be clear about this because you go to the grocery store and there's a zillion different kinds of yogurt. I'd say 90% of them you can't eat because they're all full of sugar.
What it would be like plain yogurt. What would you say in comparison to like Greek yogurt?
Greek yogurt's excellent. Greek yogurt and regular yogurt are almost the same thing, but you drain some of the whey out of Greek yogurt so it's a little more dense. It's a little firmer. It's actually a little better, I think.
I prefer Greek myself.
Yeah, and also I like the Greek yogurt with the most fat in it that I could possibly get because the fat also helps balance blood sugars. If I eat Greek yogurt that's got some fat in it, my blood sugars don't go as high.
So what would you say about the keto diet in diabetes?
Keto diet is absolutely the best diet you can get for diabetes. There's no diet that's more effective to regulating your blood sugar. Now, having said that, I almost never recommend people do a keto diet because it's really hard to do a keto diet for the rest of your life.
It is, and then people, once they go off of the keto diet, is when they gain all the weight back. And I only know from like people I know who have done keto for weight loss purposes, not for treatment of diabetes, but just for the aesthetic reasons.
So keto diet will lower your blood sugars more than any other diet because there's no sugar in the keto diet.
Yeah, no carbs.
And if there's no sugar, then when your body has to make ketones, that's why it's called a keto diet. And the way you measure if you're effectively following a keto diet is you do a finger stick for your ketones. Your ketones need to be above 1.9. If they're above 1.9, you're in ketosis. If they're below that, you're not in ketosis, at least not enough to count. And so you have to figure out where the sugar's coming from and eliminate it. For me, it was almonds. I was eating almonds. Come on, almonds are not like a high sugar food. It wasn't candy.
When I was on my last week of prep, I was able to eat a half of an avocado and 4 almonds.
Right. So almonds turned out to be too sweet to keep me in ketosis, but I could eat pecans.
Huh.
Those were fine.
Okay.
So see, there's this real subtle touch, but this is a weird diet. This is like an emergency diet. This is like, oh my God, nothing else works, and I have to do this thing for some reason, and it's really hard to keep on it for more than a year or two because the rest of the world's eating carbs, and carbs are sweet and delicious, right?
Right. Okay. So going back to our main
shorter with keto diet. How do we treat this? So this is number one. We want to have protein. Now, how much protein? Not much. Just a little bit. A couple of fingers, 3 fingers, maybe 4 fingers
ounces
of protein.
So
each one finger eats an ounce, so it's a minimum 2 ounces. 4 ounces is a decent amount of protein. Now, if you're super active, you may want to have more protein than that, but if you're not active, you don't really need much more protein than that. So it's really not that much. It's an egg or 2, a hamburger patty, or a chicken breast. Smallish piece of fish. All these are adequate.
Okay.
Then that's rule number 1: protein with every meal. Every meal, mind you. Every single meal that you eat.
Yes.
Rule number 2 is vegetables or fruit with every meal.
Okay.
In fact,
fruit?
Or fruit.
Fruit's high in sugar.
Well, some. So not all fruits. For
Not
people with diabetes,
grapes.
Grapes are a problem.
Not
You're exactly right.
bananas.
Ripe bananas.
Not ripe banana. They can have green
bananas are fine.
But who wants a green banana? Who wants a woody
Some people
banana?
like them that way.
I personally do. I like them on the greener side, but
Yeah. Because the hard thing to do is to stay on this as a regular routine, to get used to it, to have this just be your normal life. It's like, ooh, what's for dinner, right? And you're excited about it because this is how you live, and you don't do anything else. That's the trick. The trick of diabetes treating it is setting up the pattern. You have to be willing to do the pattern. This is the reason why we talked about all the bad things about diabetes to begin with, is because we want to set up the motivation
you need to
make the changes.
Yeah, you need to have that incentive.
Yeah. Okay, so eating mostly fruits and vegetables, and how many really? So it's kind of pie in the sky to do this one, but I'll give you the number to shoot for. Once you get it figured out, you'll settle into this number, and that's 6 handfuls a day. Now that's 3 meals, 2 handfuls. So I have a handful of broccoli and I have a handful of green beans. Okay, that's my breakfast.
But
No.
your hands are bigger than my hands.
And that's fine.
Okay.
That's fine. Just because that's why we say handfuls, because I'm bigger, I need a bigger handful.
Sure,
You're smaller,
okay.
you need a smaller handful.
Okay.
So what is a handful about,
A
roughly? It's about half cup.
Oh.
About half cup, not a cup. Okay, so you get 6 of those in a day. The last one is carbohydrates, which is tricky. Some people have diabetes that's so bad they can't eat any carbohydrates. Some people that have diabetes, it's not that bad. They can eat some carbohydrates. All they have to avoid is sugar or concentrated processed food.
Carbs.
So the most people with diabetes, if they simply avoid processed carbs, where they take and they grind it into flour, and they take the endosperm out and just leave the white carbohydrate in powder form, that stuff will make your blood sugars go up quicker, better, faster than anything on the planet. That white powder, otherwise known as flour.
Yeah.
Flour is the real enemy, not sugar. Flour, more than sugar, is the enemy with diabetes.
So would you recommend diabetics also go gluten-free as a dietary restriction?
No, not necessarily, because there's lots of flours that aren't gluten.
Okay.
There's cornmeal, and there's rice flour, and there's
almond flour.
Well, it's a million different kind of flours.
Yeah.
And all the
Coconut
flours do the
flour.
same thing. They put too much sugar into your blood. Almond flour's got a lot of protein in it, so it's not as bad as some, but for most people it's bad.
Okay.
It puts too much. It's like an alternative. You make cookies out of almond flour.
Yeah.
They still have sugar in them. They still have flour in them. They still push your blood sugars up. In fact, the best way to actually manage this is not to follow the rules I've just given you. We're trying to set up a pattern to live by, so the rules are a good place to start. The real way to check your blood sugars and to see what's working is to run a continuous glucose monitor.
Yeah, and that's what
That is the actual treatment.
we have all of our patients doing in the clinic. They
And
run.
it has changed the treatment of diabetes. It makes
And
it so much better.
The advancement of continuous glucose monitor has given us an extended view of blood sugars. Back in the day, people used to have to prick their finger and read their number every 2 to 4 hours or whenever they'd feel their body changing. But now you can just stick it on your arm and it's uploaded to your phone, and you have a graph of every moment in the day.
It checks it every 5 minutes.
Yeah.
That's how often it's checking. It's every 5 minutes. And so you get to see this fabulous graph of your blood sugars. And so you get to see for yourself what makes your blood sugars go up and what makes them not go up. And it's different for different people. Let me give an example. Potatoes. Potatoes, for most people, make your blood sugars go up like crazy. They shoot up like the Eiffel Tower. Zoom up. And for other people, no, not so much. They can actually handle a little bit of potato. You eat too much, it's a problem. But you eat some potatoes, got some bacon bits and some sour cream on it. You got some fat and some protein mixed in with the potato, and it turns out to be okay.
Mm-hmm.
Turns out to be like real food.
Mm-hmm.
Isn't that lovely?
Yeah.
What? You'd be so lucky to be a diabetic and to eat potato. That's great. They do exist. These people are real.
You're
They
right.
actually live among us. Yeah, they're rare though.
They're very
Most
rare.
everybody else eats potatoes, and their blood sugars go way up, and they go to hell in a handbasket.
And so the diabetic that I know that monitors their blood sugar with continuous glucose monitor, theirs normally spikes at noon after a 4-hour period of fasting before they've gone into their routine of having their next meal. So,
Why is that? Wait. Let's for the listeners. You know somebody whose blood sugars spike, and they didn't eat anything.
They don't.
What the heck? They're not even eating, their blood sugar spiking? How could that even happen?
Their body is looking for it. Their body is scouring for the resources that it needs, and it takes it out of the reserves.
Yeah. Turns out we have sugar stored in our body. And so when our body gets hungry and we start, having this feeling, right?
It's a panic.
And so what our body does is it releases cortisol, which it secretes cortisol, which releases glycogen. Glycogen turns into glucose, and your blood sugars go
And
up.
I didn't know all the hormonal pathways of it.
Cortisol triggers glycogen. Glycogen releases the sugar.
Okay.
That's how it works. And your blood sugars go up. But Dr. Luper, I didn't eat anything. Yeah,
You've
sucks
heard
to be
it
you.
time and time again. Yep.
Yeah. This is a common problem, and you would never know unless you had a continuous glucose monitor. Funny story. I had a patient because she was gaining weight and she was exercising like a fiend and eating well, and she just couldn't figure this out at all. And I had her do a continuous glucose monitor. She came back and I could see her blood sugar spiking every day, dude. Every day, boom. And I said, "Here's your problem. This is the reason why you're gaining weight." She didn't have diabetes. She had weight gain. So what are you eating at lunch? And she said, "Nothing." Well, what do you do at lunch? I exercise. What exercise do you do? CrossFit. I said, bingo, that's your problem. Your CrossFit exercise is too intense. It's making your blood sugar spike. Your body's releasing insulin. It's taking the sugar and packing it into fat, taking it from the shallow stores and putting it into the deep stores. What happens is you didn't eat anything and you just got fat.
Yep.
And it's a true story, an actual true story. And so what we had her do was to not exercise so intensely 4 days a week. 2 days a week she could still do the CrossFit. 4 days a week she had to change her exercise.
Go for a walk.
And it turns out that it worked great. Her weight came off. The whole thing worked well. We would never found that in a million years. Come on, it sounds crazy.
And two, along with exercise, stress. And
That'll do it.
That'll do it. Your
That'll do
body
it. Same
doesn't
thing.
know the difference because it's still releasing the cortisol as if you were not eating.
Yeah, so let's go back to the diet. So I'm going to reiterate this one because this is the most powerful tool we have to treat diabetes, actual real diabetes. So what we do is we make sure patients have protein in every meal. They're living mostly on fruits and vegetables. They may have some carbohydrates in their diet based on their ability to tolerate them. But whatever carbohydrates they're going to have, they're not going to have any sugar, they're not going to have any flour, any refined carbohydrates. What they can do is they can eat some whole grains maybe. I'll give you an example. So let's say we're back to the yogurt thing. Let's say you're going to have some yogurt and some berries and some nuts and some whatever. You throw some stuff in the yogurt, mix it up. This is your breakfast. Now the question is, can you put granola in? The thing about granola is a lot of times there's going to be honey mixed in it to sweeten it up. That makes it a problematic. Or there's going to be some kind of dried fruit in it. Now, dried fruit, now that's fruit, Dr. Luper. Dried fruit is fruit, so it counts. No, it doesn't. Dried fruit is just turned fruit into candy. And the sugars are way too concentrated and your blood sugars go up. We were eating mango at my house, dried mango.
Oh, the mango with all the sugar?
No. This is the sugar-free stuff.
Okay.
Just the regular mango dried. And I was like,
that's not fun.
That was the best thing ever. No, it was totally great.
Yeah.
And it was absolutely a treat. It turned out it was causing my blood sugars to go way too high. We had to swear it off. We can't buy mango anymore and eat mango because it's dried fruit. And, we went down fighting, trying to figure out what we could eat. So this is what everybody does, and not everybody, but most everybody. You should try to eat what you can get. If it's sweet, it's good.
Mm-hmm.
If it's got carbs in it, it's good.
Mm-hmm.
Macaroni is good,
Mm-hmm.
right? Lasagna is good. Pizza is good. All these things are good. So how much pizza can I eat? And the answer is little or none.
Mm-hmm.
And we're going to see what you can eat based on your continuous glucose
right.
monitor. And in the meantime, we're going to set up this pattern to where you're going to live by so that occasionally, maybe once every 2 weeks or once a month, you can have a couple slices of pizza and it doesn't blow you up. Remember, we'll go back to our earlier conversation. Here's how much sugar you can clean, and here's how much sugar you're making. This is bad.
Yep.
This is death, destruction, and despair. We got to bring it down.
Mm-hmm.
So how much carb fits in here? Some.
Mm-hmm.
Not none.
Not a lot.
Not a lot.
But some.
No, for some people, zero. They have no carb whatsoever. They can't eat any carb whatsoever. They eat anything, their blood sugars are going to go for the roof. So they literally have to eliminate them in total, and we have to take them to the next level because sometimes they're so broken that their insulin producing cells don't produce enough insulin. Those people, in order to treat them, we actually have to put a little bit of insulin into their
bodies,
bloodstream with an injection.
I do have one more question before we wrap this up about diet. What do you think about apple cider vinegar before every meal and the fermentation process and reducing blood sugars?
So apple cider vinegar, I like.
Or if not apple cider vinegar, sauerkraut, kombucha, kimchi.
Yeah, so
just
these
the
are
fermentation.
sour things.
Yeah.
Fermented foods generally are good for your digestive system. They have they promote probiotics to function well. They have some probiotics in them already. Lactobacillus. Most of these are lactobacillus fermented products. So this is beneficial to you. Apple cider vinegar is also a product of fermentation, but it's more concentrated into vinegar only, and really it's not so much for the fermented part that we like it, it's because it's an acid. So if our digestive system, in order for it to work well, it needs to have acid. If our digestive system gets weaker, as we get older especially, some people are born with a weak digestive system, other people come at it honestly over a lifetime of working it hard. But this weak digestive system does occur in the population around us.
But
if you add some acid, digestion's improved.
It does, but what does it have in correlation to metabolizing the sugar in the blood?
Not a whole lot.
Okay.
it's not particularly effective against diabetes.
Okay.
It is particularly effective against stomach upset
Yeah.
and gas and bloating and kind of weird, difficult stomach problems. So there's that. I mean, it's not like a mainstay that I use to treat diabetes. I don't.
It was something that I just, had in conversation over the weekend with somebody, and I was like, oh, I want to ask my doctor about that.
Yeah, so not so much. So there it is.
Well, I think that might be
Okay.
as much as we have for the show today, so we'll get into more next show. Thank you.
All righty, my pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.